Hello, everyone. We are going to be talking about tuberculosis today. A lot of this you have already seen, and it's going to be a little bit repetitious, but just bear with me here. There is some new slides. There's some new information. Pretty quick presentation, not too bad, but there is kind of a lot, not too much. But anyways, quick reminder. I believe I showed you this already. RIP Selena. CDC website is going to be the #1 resource for you all as students and practitioners. So I just want to remind you guys about that. This is where I got part of my presentation slides from, some of these tables and stuff. So if you're interested in maybe getting some more tables or having some more resources, this has a ton of stuff, has some good graphics. It has information for patients as well. I don't know if I mentioned that before, but a lot of things here, professional tools and resources. Sorry about that. Lots of stuff here. This also, I wanted to highlight too, this also has a section for the treatment in specific populations. So these are things that I'm not going to go over and you aren't going to be responsible for my testing purposes. Again, don't know for ICM or for your other courses. So check with those professors for that. But for me, I'm just going to kind of do, for lack of a better way to say it, plain vanilla TB. So just kind of average adult TB. But if you did need more information, or if you were working with the pediatrician or you're working with an infectious disease doctor, the CDC is great for treatment of TB with treatment of children, pregnant women, and then people who have HIV. So those are specific populations that, again, I'm not going to be covering in detail, but here is where you can find those if you need to. So that's it from the CDC website from me. So let's just jump into the presentation now. All right, you guys probably remember this table from our first module. We went over all the infectious disease drugs, but we're going to be looking specifically at the ones that treat TB. And just real quick too, yes, there will be TB drug questions on this upcoming exam for pharmacology. So doing a little bit things a little bit different in the past. So your upperclassmen may not be familiar with this, so if you ask them about it, it is a little bit different. And so we did infectious disease in the beginning, and we're going to be doing it the entire year. And so for this exam, it's going to be the TB, and there's a couple other lectures too we'll go through. But so there's some infectious disease stuff that's related to pulmonology. So anyways, first we have INH, the isoniazid, and this is just all review slides you've already seen. So I'm not going to spend a ton of time on them, but definitely look at them. I mean, refer to your old notes too if you think that would help. But mechanism of action here, pay attention to it. It is good to look at and make sure you guys know how these work. Use, it's for TB, and that's why we're talking about it, and specifically in a combination with the RIPE combination. So isoniazid, but we have rifampin, ethambutol, and the pyrazidamide. Adverse effects. So definitely put a star here. Guaranteed test questions are going to come on adverse effects for the TB drug. So please make sure you put a star by here. I want you to know those for testing purposes. So spend some time here. Make sure you memorize these. Same thing with rifampin. Look over it. Make sure you know the mechanism of action, and please know the adverse effects. So, and you'll notice too the hepatotoxicity. Note too where, where the adverse effects are similar. So some you have to be concerned with the hepatotoxicity, but others have unique characteristics. So again, kind of spoiler alert or whatever for the exam, guaranteed there's going to be a patient who comes in and has red-orange discoloration of urine, tears of saliva. So what medication are they on? Or they are on this medication and then they're on rifampin. Which of the following could be a potential adverse effect? So I've had students in the past ask me about if I'm going to be tricky with them, and I'm not going to do this on purpose, but I will pick adverse effects that are kind of signature adverse effects that are meaning that they are the one. So for example, rifampin is the only one of these TB drugs that causes red-orange discoloration of urine, tears, and saliva. So I won't put things like hepatotoxicity in there, but I mean, still know it and know that it can cause, because I could have a question too where I ask about, if you have to be concerned with the liver, if there's a patient who has issues with the liver or they have hepatotoxicity or whatever, so I mean, still pay attention to it. And definitely, like I said, star these slides put a star, and I want you to know the adverse effects for these drugs. So hopefully that's helpful for studying purposes. Ethambutol, tongue-tied this morning. Jeez, let me stop for a second. All right, ethambutol. All right, there it is. I gotta slow down a little bit. Anyways, so ethambutol is another one. It's part of that 4-drug mainstay cocktail right now. Mechanism of action, of course, and adverse effects. Put a star by that on this slide. I want to make sure you guys know that. You're noticing a pattern here, probably. You guys are all catching on, right? This one as well, same thing. Make sure you know the mechanism of action. And then adverse effects, and put a star by there. And then you notice too, I already mentioned this, but hepatotoxicity keeps popping up. So notice which ones they have in common, but then also please note which ones are unique or signature adverse effects. Rifabutin, know about it. It's just that, I mean, it's important. It's like rifampin in that it can be used. This is going to be specifically for the HIV patient. So like I said, it's for that special population. I'm not going to go into detail and depth with the HIV, but this is something to note, and please know that. I have seen these on some of the board practice questions. So it is an HIV infected patient, and then you have to know that they're on, or that they should be prescribed rifabutin instead of rifampin. Streptomycin. So this is one that was used historically. You will see it in some review books. You will see it in some old questions, depending on how old your question bank is. So historically, there were the 4 drugs, the 4 RIPE, but then they also had streptomycin. So it was like RIPES, I guess, with an S at the end. But more frequently, and so if you go to the CDC now, they actually do not recommend using streptomycin because of resistance. And so I've had students in the past come to me with questions, or they'll have to do the board questions, the practice questions, and they'll talk about streptomycin. Just note that was the precedence. That's a historical precedence that has changed. And so this presentation is based off what the CDC says now. So the CDC, again, plain vanilla TB, your average tuberculosis for adults, it's going to be those 4 drugs. Alternative drugs, know the list. I want to make sure you guys know which ones all are alternatives. I mean, this includes streptomycin. Just memorize it. I'm sorry. There's sometimes in pharmacology you just have to memorize things. This is going to be one of those lists. I want you guys to be able to pick out these drugs as that they are alternatives, or that they can be sort of part of your toolbox. And then again, like I said, I've seen them pop up on board review questions, etc. So now so that's all the old stuff you've seen before from my other presentation. I just copy pasted it, and it's just there just so it was clear and concise. Initially, when I did this, I didn't have those older slides, and students were not happy with me, to say the least. No, they were polite about it. You guys are professional and polite, right? But they just were like, why don't you just put them together? Just copy and paste, So anyways, because I was like, you guys can do that. They're like, you can do it. But anyways, so I did it this time. I can do it. So I did it this time for you guys. So hopefully it's just kind of a one-stop shop, hopefully, and for this. So you don't have to go find your old notes, or maybe you burned everything from the first module. One student jokingly said that they burned everything, which we have a cumulative final. So please don't burn everything after each exam. I would not recommend that. I mean, at the end of the year, or when you graduate PA school, you guys could have a bonfire or something. I don't know, but wait at least until the end of the semester. No, but yeah, things do build with pharmacology. They do build on themselves, and you will be seeing a lot of this stuff in the future. So anyway, so this is from the CDC, and I like their slogan here. So I put that the CDC 24/7, saving lives, protecting people. I thought that was like really, that was really like hashtag like a boss, right? That was very much impressive. Let's just say the least. I like their slogan. Not that matters, and that's not going to be on the test, so don't worry about memorizing it. Some background here, just read through this. This may help with PathoPhys or ICM. Just want to make sure everyone's on the same page. So don't stress too much about memorizing this for my exam, but it is good to read through. Resistance is a big issue, so compliance is a very big issue. And you want to make sure if you have any patients that are on TB drugs that they are taking them, and they're taking them as prescribed, and they're not missing doses, and they complete the full course. So they have to be on these, unfortunately, have to be on these medications for a long period of time, which we'll get into the details here in a little bit. And that's hard. It's hard. I mean, I don't know if you guys ever have had any time where you've had to take a medication. But for even, they've done research studies with pharmacy students and different medical students and stuff where they have them take a vitamin C tablet every day. And at the end of the semester, at the end of the year, whatever, they count them, right? They call it a drug audit. So they audit the person, and the majority of people are not compliant over a long period of time. I mean, it's hard enough even just like for a week or whatever for people to do. It's hard to do the exact same thing every day. But anyway, so take home point, compliance is hard. And so resistance is an issue. And that's what we saw already with streptomycin. Unfortunately, that is becoming an issue. So in the future, and this is from the CDC, it's not just me like making stuff up, but it's probably going to be harder, more expensive. You're going to see more resistance. And so just be on the lookout. And then if depending where you end up practicing, you guys are end up in a lot of different kind of parts of the world, parts of the PA world, I guess I should say, not that you're going to like Antarctica and stuff, the PA world. If you haven't seen a TB patient for a few years out of practice, just go to the CDC website, and that'll give you the most up-to-date kind of current guidelines as far as resistance, etc. This is what I was talking about earlier. They may have to take the medications up to 9 months, which is a long time to be taking the medication, especially going back to those adverse effects. If they are causing you to have orange tears and weird urine colors, or if they have hepatotoxicity, right, that can be less benign maybe. So that is something that is also part of the problem, or can be kind of problematic with the patients. And it definitely involves, or rather should involve, a kind of a coordinated healthcare effort from the whole healthcare team or whatever to make sure this person's taking it. And, pharmacists were involved, but, definitely as PAs, you guys will be involved as well. And then this just FYI, there are 10 drugs that have FDA approval for TB, but then there are the 4 that we need to worry about, and those are here. So definitely memorize those. Again, I want you to make sure you know which 4 are the current first line treatments. So it's RIPE, RIPE, or I like RIPEZE, that helps me remember it, but Peer, Perry, whatever it takes. Just, again, sometimes in pharmacy, you just have to memorize things. It's like learning a new language. You just have to memorize that one word means another word in another language or whatever. So just please memorize those. Again, put a star by that. I want to make sure you guys know that. Students have asked me about the abbreviations. Go ahead and learn the abbreviations. It's not a bad thing to do, but I will be spelling the drug names out for the exam. So I won't just put the PIZA or PZA here on the exam and just, I will be spelling the name out. I may have these, they may be in there as far as in parentheses. I'm not sure yet. I haven't written the exam as of recording this. But I do, and the reason I'm saying that is because you see them on people's charts, you see them on health records. People abbreviate these drugs a lot, especially because it's, they're 4 drugs. Instead of writing out the 4 drugs, they'll just write out the 4 abbreviations or, anyway. So yeah, the abbreviations in this instance are important, I believe. So anyways, this is just letting you know that there are these phases of the prescriptions, and so when they are prescribing, or when a person's on it, it kind of depends on when you see them to tell if they're in an intensive phase or the continuation phase. I like this table here. This is again from CDC. If you want this table in a better resolution or whatever, just go to their website or reach out to me if you have trouble finding it, if you have trouble reading it or whatever. I think it's pretty big and pretty clear. But preferred regimen, put a star by that. Definitely want you guys to make sure you know that. And again, I had students ask me, do you want me to, am I going to test on this as far as how many days, etc.? Not for my exam, but it may be relevant in ICM. So it's not a bad idea. Again, put a star by this whole thing. So there's the intensive phase, and then there's the continuation phase. Probably not a bad idea to start to study this and to learn it, but definitely for my exam, I want you guys to know the drugs and then adverse effects and these other things that I'm highlighting. And here's another table showing the same thing. It's just in a slightly different format. If you notice, preferred regimen, again, it's horizontal. Oops, the preferred regimen here is horizontal, and this one's just vertical. I just included both of these because I felt, just kind of depends on your preference as far as what's easier for you to study or easier for you to memorize. For some reason, this table is easier for me to kind of take this mental picture of and learn it this way. So, but whatever. However you learn it, doesn't matter. So here we have the continuation phase. Just read through this. Don't stress about this too much for my testing purposes, but again, this may help in ICM. And I just put it in there just for the complete picture. I try to make things more complete, even if it's not heavy for my exam questions. And then completion is, you notice back here, there is actually a number of doses. So there are clinics and there are instances where you count dosages and you want to make sure that the person has, successfully ingested up to 56 doses, let's say. So that is important. And then that's where you can have the official kind of completion, the treatment. Drug resistance, I touched on this a little bit. It is unfortunately an issue, and it's becoming more of an issue. And there is MDR-TB, which is multi-drug resistant, and then there's XDR-TB, which is extensively starts with an E, but I guess it looks cooler. I don't know why they put the X there, but it's XDRB, DRTB. All right, got it. Less common, but anyways, it's out there too. So you may see those popping up, or may see those out in practice. Hopefully you don't. But in those instances, and especially with the XDR-TB, hopefully a specialist has seen that person, and it's and that's definitely something where you do have to be more careful, and it is more serious of an issue. I talked about this earlier, and refer to that CDC website that I showed, and they have links there. But these are the special populations that I'm not going to go into detail with. But if you need resources for ICM or for your other courses, please, definitely, use what the professor gives to you guys. That should be a good starting point. But then if you need additional stuff, the CDC has some great things there. But again, just to be repetitive, testing purposes for me, don't stress about that for my exam. Adverse effects. So again, put a star by here. Want to make sure you guys know about the adverse effects. Again, this is something that, because some are problematic and then some can be detrimental. And these drugs are in the person's system for... Sorry about that. Unprofessional. I forgot to silence my phone. So, all right. What was I saying? Yeah, so adverse effects, and because these are in a person's system, and they're exposed to it for 9 months, so it's a long time. But anyways, and so definitely, hopefully it's clear. I want you guys to know about adverse effects. And you'll note too, you've already seen this, but it's the asterisk here. Definitely the rifampin is something that you need to make sure you tell the patients, because they will freak out. People freak out if all of a sudden they're orange or whatever. So that is something to let your patients know about. More adverse effects, put a star by that. Make sure you guys know that. Drug interactions, also put a star by here. I want to make sure you guys know that there is a potential for drug interactions. And like with a lot of chronic conditions, the reason it is important, or maybe a little bit more relevant, is because they have to be on these medications, and they have to be on them for up to 9 months, so long term. And so it can be problematic if, like, let's say, so phenytoin is a seizure medication. So if they have to be on the phenytoin for their seizures, and then they have TB, very unlucky person, unfortunately, then you have to think about the drug interaction. So in this instance, it increases the blood levels of phenytoin. So you're able to take blood levels, and you may then have to adjust the dose of the phenytoin of the person, so you'd have to lower the phenytoin dose, potentially, while the person is getting their TB treatment, right? So I want you guys to think about that, look at those. Notice that some warfarins on their phenytoin, those are the ones we've seen before, but some other ones too, the antabuse, disulfiram, methadone, the sulfonylureas, oral contraceptives. So depending if a woman is taking those, that can be an issue too. It result in an unintended pregnancy. And then you have the complication of having a pregnant woman who has TB, and then you have to, that's just a bigger issue. But anyways, also with HIV patients too, special population. A lot of the HIV drugs have a drug interaction. So put a star by here too. I want you guys to remember and note that you do have to be mindful of drug interactions when a patient is being treated for TB. And now another great resource, or more locally. I don't know if you guys are going to end up practicing in Texas or not, but definitely, well, as your students in Texas at least, the Texas Department of State Health Services is a great website. There is a link here. I don't know if the hyperlink still works, but just Google that and go to their website. They're based out of Austin, and they have some great resources specifically for the state of Texas. So it may be something that's worth looking at. Maybe give them a call. Maybe send them a fax. No, I think they have an email too, but they may be worth looking into if you are practicing in Texas, because depending on what part of the state you're in, which will show some maps here, depending on the part of the state you're in, there are some higher instances, and I can't remember what year this. Oh, it's 2015. Okay, 2015. So Harris County was the highest number of cases. So if you end up practicing in Harris County or Fort Bend County, but then you also notice too along the border here where we're in Hidalgo County. So that may be an issue too if you end up practicing down here. And then also too depends on what population you're working with. For example, if you're working at a prison or with a prison population, or as my wife calls them, the FI population, they're called freedom impaired, which she just never heard that. But up here in the hospital, there's a couple of prisons nearby, and so they get prison patients, and they call them FIs. They're like, oh, there's an FI in the ICU, and when she first came here, she's like, what's an FI? But they were freedom impaired, so I'd never heard that. So if you end up working with freedom impaired or FI patients, that may be something. The other thing too they say, which is, it's a joke and it's kind of mean, so I'm sorry, but they also say they live in there's gated community patients, which, sorry, that was a bad joke, but yeah, dad joke. But that's something else that they'll say. But FI, I thought was interesting. But so anyways, if with prisoners, unfortunately, there can be higher incidence as well. You notice here, higher incidence. Also foreign-born, so that is something that is all over the state of Texas, but that is where it's going to be the highest risk factor. But you notice all these other risk factors. Healthcare workers, you guys are going to be joining the healthcare worker pool. You're on that just because of exposure, because you guys are going to be treating these sick patients, and so that may be something. And then also depending on what other patient population. I mean, diabetes is a big one. That's a big one that you guys will more than likely come across in your patient population. So that is another thing, another risk factor, but you can see this. And the reason it's 2015 is because as of checking, that was the most current data I could find. But if you are interested or you want more current data for Texas, please reach out to them. Like I said, give them a call or email them if you for whatever reason, wanted. The Texas stuff, students have also asked me, I'm not going to make you guys memorize this or anything. This is just more FYI, just because you guys are in Texas, and then a lot of our graduates end up practicing in Texas, and so we're kind of focused on this. But don't stress about memorizing this. I've had students in the past ask me, and these risk factors too. Just know. I mean, I think it's just more FYI. Yeah, it may be helpful for other courses, but I'm not going to test you guys on these risk factors. Another thing too, just go ahead and read this. Just highlight that there are higher rates in the Texas-Mexico border, which you guys are going to be at. I don't know if you're going to end up working down there, but you definitely are going to be students down there. So it's going to be something that you'll probably come across. When I was a pharmacy student, I did all my rotations down there in South Texas, and there was at least a couple TB patients that we saw. So that was interesting. So it was one of those things we heard about in school, and they're like, well, I don't know if you're going to see any or not. And then pretty quickly, us Valley students, we saw them pretty quick. But anyways, and then TB plus HIV is going to be more likely in urban areas. So just go ahead and read through this. And again, it's just FYI. I won't be pulling test questions from that for you guys. That is it for me. If you have any questions, comments, feedback, please email me. And thank you guys again for your time and attention. I really appreciate it. And I'll talk to you all later.